Hi everyone, I'm here today to talk about the Symphony Breast Pump. I want to talk about the setup and then the programming on the pump. So this is the Medela Symphony Pump. This is the pump that you're going to find in most hospitals, and this is the pump that is for rental purposes. When you get the pump, you will also get a kit for setup. And inside the kit, there will be two different size flanges. So inside the kit, these are 24, and you will see on the plastic, it will say 24 millimeter, or the other size will be a 27. So again, you can see there's just a little difference in the diameter of where the nipple would fit. The other thing that you're gonna get inside the kit, the kit comes with the tubing, and you will take the tubing and these little cups. These go right on the top of the pump just like this. They click in and the door closes, okay? There are sets of tubing that are attached, and then you will also have the bottles that come with the pump that look just like this, all right? Inside the bottles, you're gonna see this little piece right here. This comes off. When you clean everything, these should all come apart. This is where the suction is formed. So if you're having trouble with your suction on your pump, you always want to make sure when you place this little white piece here that it lays flat against this little yellow piece. This fits right onto here, okay? And then this fits down inside the bottle. The flange or the breast shield goes right on top just like that. And then the tubing plugs in just like that, okay? So when you pump, you are going to turn on the pump. So the Symphony Breast Pump basically has two settings. When you turn the pump on, what you're gonna see is on the pump right here, it says initiate press milk drops. You would press those milk drops in the first 5 postpartum days, and or when your milk supply is 20 mLs or less. So if you're within those first 5 days of pumping, that if your supply is 20 mLs or less each pump, you would want to use this initiate program. Once you're past pumping 20 mLs 3 pumps in a row, or postpartum day 5, then you would switch over to the maintain phase, okay? Going back to the initiate phase. So that phase, Medela created that phase of this pump to basically kind of bring in your milk. You're gonna notice in that initiate phase, there's gonna be different cycling with the pump. There'll even be points in time where the pump will shut off. The other nice feature about the initiate phase is that at 15 minutes, the pump automatically shuts off, okay? So, again, to recap, if you are within those first 5 postpartum days or pumping 20 mLs or less, then you really need to use the initiate phase. And that's where you simply turn the pump on, hit the milk drop button, and the screen directs you to do exactly that. You'll also know that Medela has a sticker on the pump, and it tells you the difference between the two programs, okay? Once you're 5 days postpartum or pumping 20 mLs 3 pumps in a row, you would no longer use that initiate program, okay? So we're gonna turn the pump off. We're gonna go over the maintain program. To use the maintain program, it's super easy. You just turn the pump on, okay? And you do nothing. The pump directs you. If you want to use the initiate program, press the milk drop button. We're not gonna do that. So we're gonna go ahead and adjust your suction right here. This turns the suction up or down. I typically tell moms that when you're pumping, you want it to feel like a pulling and tugging, pulling and tugging. It should not be hurting. It shouldn't be pinchy. It shouldn't be tight. It should be nice and comfortable like a pull and a tug, okay? So when you're pumping, let's talk a minute about the breast shield size. So I already explained in your kit there'll be 2 sizes, a 24 and a 27. There are 3 additional sizes. of breast shields, or sometimes we'll call them flanges. You might hear us lactation consultants calling them flanges. So there is a 21, Medela makes a 21 millimeter. We talked about the 24 and the 27. They also make a size 30, okay? And again, it's always on the plastic. And then they also make a 36, okay? This is not relative to breast size. It's relative to nipple diameter. So when a mom is pumping, that nipple should slide in and out of the breast shield comfortably, okay? You shouldn't see gapping or cupping. You should just see some nice movement, okay? The other thing to know is that with the Maintain program, the pump and the cycling, the program with the Maintain phase is that the pump will cycle quickly for the first 2 minutes, just like a baby who is coming to breast and they're hungry, they're ready to eat, they suckle at a faster rate. And then once you see letdown, the milk and the pump is gonna mimic that, like what a natural baby would do. So after 2 minutes, and you can see the pump just switched over, it slows down, okay? One thing I always like to tell moms is when it does that, you may need to adjust the suction a little bit more, all right? You might notice that it feels a little bit stronger, so totally fine to just turn down your suction a little bit, okay? You don't have to be superhero and crank your suction way up. More is not better, all right? So typically with double pumping, we'd like to see moms double pump if they can. It's more stimulation to the brain and the breast. We like to see you double pump somewhere between 15 and 20 minutes. One little tip that I can offer to you, especially those moms who are struggling with milk supply out there, that when you look down and you start to see the milk just really slowly drip, 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 instead of the nice sprays that you see early on with letdown, go ahead and press this milk drop button. Just press it. And you can hear it takes us back into that cycling that's a little bit faster, okay? Sometimes that's enough just to initiate another letdown and get you more milk. With this Maintain program, at the end of your pumping session, so again, 15 to 20 minutes, you're gonna go ahead and you're gonna have to turn off the pump, okay? This does not have an automatic shut off in the Maintain program. So you would turn off the pump, just like that. Whatever milk that you've collected, you're gonna take this off. Another little hint might be, if moms are struggling with supply, is to go ahead and do a little bit of manual expression and see what's left in the breast. Again, this is a piece of equipment. It's not a live baby. Live babies typically drain the breast really well. This is a piece of equipment that we're asking to do that. So sometimes if you just express a little bit, you might get a little bit more, okay? Especially if you feel and your breasts don't feel soft, then it's probably a good indication to go ahead and do some manual expression, all right? So you would take whatever milk that you've pumped and you would empty that into whatever storage container, storage bag you're gonna use, and then you're gonna wash everything that the milk has touched. So that would be the bottle, that would be this white piece, the yellow piece. You're gonna find all kind of little milk in here, all right? And then this comes apart as well. You do not need to wash the tubing. There should never be milk in this tubing. If there's condensation, now there's a lot of moms who will tell me they see condensation in their tubing, while you're washing everything in hot soapy water, then go ahead and just turn the pump on and that will clear that out. So go ahead and wash your things. When you're done with washing, you're gonna wash it, nice hot soapy water, rinse them with nice cool water, and then you're gonna air dry them, okay? Never put them away wet. And when you're done with that, then you should come back to your pump and the condensation should be out of your tubing, okay? So we're gonna turn that pump off. So hopefully you found this helpful. Again, this is just a little tutorial for the Symphony breast pump. Always available for questions. Be happy to answer those for you. Thank you.